Ministries program. I'm so excited because we're going to be talking about something that we all have, which is a pelvic floor. Did you know you had a pelvic floor? Okay, see, great. So, our speaker today is none other than Dr. Katrina Heath. She's a pelvic floor physical therapist. She's also my first cousin on my mama's side. You might see the resemblance. But she is a professional, just not my cousin. But I am excited because she has been in this field of pelvic floor for like 22 years. Yeah, we look good, don't we? Okay, but she's been in. So I'm excited because we need to, what we're going to be discussing today is not an age or gender-related issue. It can happen to any of us. So we want to make sure that we are prepared and that we will have education rather, to talk to our doctors and get the proper care that we need. So without further ado, Dr. Katrina Heath.
Hello, everyone. Hello. I need some energy. Hello, everyone. Hello. All right, we are here today. I'm excited to be here with you. My name is Dr. Katrina Heath, and like Natalie says, we've been cousins all my life. And I'm very excited to be here with you all. I feel like Emmanuel Temple is actually a part of my family because I used to come here during the summers when I was little. My Aunt Joyce used to take me to vacation Bible school here, and I used to come and spend at least 2 weeks every summer, I feel like. So you all are a part of me as much as I'm a part of you. I recognize a lot of faces, even if I don't know names, but I'm thankful to be here, and I give God all the glory for allowing me to be in this place. So if you don't mind, I would love to open up with a word of prayer, because we can do that here, amen? God, I thank you so much for all that you have done, and Lord, we ask you for your presence today. I can do nothing without you. And so, God, I ask you for your Holy Spirit to come in and use me in a mighty way. Show up and show out like you always do. And I pray, God, that you will get the glory, you will get the honor, and you will get the praise in Jesus' name. Amen. How many of you know you have a pelvic floor? Woo! Do you know what a pelvic floor is? Ha! Somebody said no. Does anybody know what a pelvic floor is? What do you think? Yes, it is a muscle. And actually, it's a group of muscles, and we're going to talk about that today. So I have an icebreaker that I want to ask you these questions, and I want you to ponder in your head if any of these things are true about you, okay? So I'm taking this from the Cozine Pelvic Dysfunction Screening Protocol. Just in case you wanted to follow along with it and find it on Google, you can actually go there and do the screening for yourself. But I'm going to start with these questions, and then I'll move forward, okay? So it says, do you sometimes have pelvic pain in your genital region, in your perineal region, in your pubic area, or in your bladder? Do you have pain with urination that exceeds a 3 on a scale from 1 to 10? So it's higher than a 3. Do you ever remember falling onto your tailbone, lower back, or buttocks, even in your childhood? Do you sometimes experience one or more of these symptoms? And these are urinary symptoms. Do you have accidental loss of urine? Feeling unable to completely empty your bladder? Do you have problems with voiding within a few minutes of a previous void? So feel like you have to go to the bathroom frequently? Do you have pain or urination with pain or burning with urination? And also, do you have difficulty starting or frequent stopping of your urine stream? Okay, keep this in mind. Is this what you say sometimes? I often or occasionally have to get up in the night 2 or 3 times to use the bathroom. Or you may say, I sometimes have a feeling of increased pelvic pressure or the sensation of my pelvic organs slipping down or falling out. Some may say, I have a history of pain in my low back, hip, groin, or tailbone, or I have sciatica. Anybody ever heard of sciatica? People say, oh, I have low back pain, I have sciatica. Well, do you? And how about this one? I sometimes experience one or more of the following bowel symptoms: loss of bowel control, feeling that you're unable to completely empty your bowel movements, straining or pain with a bowel movement, difficulty initiating a bowel movement. Do you sometimes experience pain or discomfort with sexual activity or intercourse? Do you have sexual activity that's increased with one or more of those symptoms that I just mentioned? So you have pain, you have urination, you have fecal incontinence during intercourse. And the last one, do you have symptoms that increase with prolonged sitting? So if you have answered or checked on this protocol, you have to check off these boxes. If you checked off 3 or more of these symptoms, guess what? You may have pelvic floor dysfunction. So we're going to talk about that in just 1 second. Okay. So don't be afraid. If you do have pelvic floor dysfunction, guess what? There's help for you. And that's why you're here today, to be educated on exactly what it is. So I have a company, it's called Heath Therapy. I just started it maybe a year ago in March of 2023. And my mission has been to tell at least 1,000 women, men, and children who suffer with pelvic floor dysfunction of any kind that there is hope. And so you all are a part of my story, okay? The goal for me is to establish relationships with the community, to be able to spread awareness about pelvic health. I want to be able to collaborate with mental health practitioners, mental health therapists, sexual health counselors, physicians, educators, nurse practitioners, moms groups, exercise classes, whoever will listen, right? Because all of us have a pelvic floor, and all of us need to be educated on how we can help our pelvic floor if we have any issues. So here's the question. What is a pelvic floor? And I've tried to put a picture or image of a pelvic floor. We have a model here as well, and my cousin will come right up, and she can walk around and show you, those who are interested in looking at what the muscles of the pelvic floor do. So they are a group of muscles. Somebody over here said that. It's a muscle. Well, this muscle is connected from your pubic bone in the front. So that's the hard bone that we have in the front of us, right? And it's going to also rotate around to our tailbone in the back, okay? So I'm going to have her actually show. Well, I'm showing it, right? She's standing up here, but I'm gonna need you to be the model for me. So I want you all to know we all have a pelvic floor. Whether you are male or female, you have a pelvic floor, and it looks very similar, okay? And so I would like for you, yes, to walk around. Those who are interested in seeing it, even my children, yes, we all need to be educated to know that we have pelvic floor. That they are a group of muscles between your pubic bone and your tailbone, which control the ability to be able to pass urine or feces or to retain urine or feces, right? So this is one of those topics that a lot of people don't like to talk about. Like, who wants to talk about passing poop and pee? Who wants to do that? Well, guess what? I get to do that every day, all day, when I see my patients, and I absolutely love it. Like, you either love it or you hate it, right? And so when I was in PT school at Andrews University, I did not know that I would end up in this particular place. I knew I wanted to be a physical therapist. I knew that that was something that I was called to do. But one day, I had a guest lecturer come into the classroom and talk about pelvic floor health. And I was like, what is pelvic floor? When I found out that a muscle group can control urine and feces, I was like, what? We can rehabilitate that? So I can help my loved ones, those who are having problems with this issue? What? I was like, oh yeah, I'm all in. So that's why I'm here today. That's a part of my story. And so I will say this, a lot of people don't like to talk about this issue. And why do you think we don't want to talk about this? Because it's personal. Anybody else? It's embarrassing, right? And so you can hide it. People will sometimes stay in the house all day because they don't want to be the ones to walk around and have a leakage issue, right? Do you know people like that? You don't have to raise your hand. It might be you, it might be your neighbor, but it exists in the world. And so I want you all to know that there is help for you. So that's what a pelvic floor is. Now, what is pelvic floor dysfunction? This is a huge term which is used to describe multiple disorders that happen as a result of pelvic muscles or ligaments being impaired. So some of the things that are more common, you may think about urinary incontinence. Who knows what urinary incontinence is? It's a big word for when you laugh and you tinkle a little bit or a lot, right? So you may go to the bathroom on yourself. It's involuntary, right? And so that's what we're going to talk about. That is a part of pelvic floor dysfunction, okay? So then you also have constipation. How many of you knew that constipation is a part of a pelvic floor dysfunction, right? This means I have to use the bathroom, and it's very hard for me to do that. I strain, I have lumpy stools, even though I go every day. I still have, and we're going to get into that a little bit more, but I have problems going to the bathroom. How many of you heard of IBS? IBS-D, IBS-C, right? Irritable bowel syndrome with a concentration in either diarrhea or constipation. That's another form of a pelvic floor dysfunction. Urinary frequency, urgency. I gotta go right now. If I don't get in there, I'm gonna pee in my pants, right? Another form of pelvic floor dysfunction. Then we have prenatal, pregnancy, and postpartum issues, right? Pelvic pain, pelvic organ prolapse. What's a prolapse? Anybody know what that is? That's when your pelvic floor muscle, I see? Yes. And your uterus can drop, your bladder can drop, your rectum can drop, your intestines can drop, right? Comes through the vaginal opening, all right? And so then we have, or the rectal opening, and then we have pelvic pain, so endometriosis, some of us have heard of that, fibroids, and also menstrual cycles, okay, that are very painful, still a part of pelvic floor dysfunctions, as well as sexual dysfunction. That means I have pain when I have intercourse, right? That means I may have never had vaginal penetration before, or maybe I did at one time, and now I can't any longer because my muscles are now tight, especially for those who have had any chemotherapy, or if you've had issues with any type of GYN cancers, if you've had radiation, those things are affected, okay? So I just want you to know what pelvic floor dysfunction is so that when you hear about it, you have the intelligence to be able to talk about it and you can direct the person in the right path. So urinary and bowel incontinence. This is an involuntary loss of urine or feces beyond your control. And so some of the causes of this include tight pelvic floor muscles. So most of the time, women have heard about Kegel exercises. They tell you when you have a baby, after you finish having your baby, go home and do what? Kegels. So does anybody know what a Kegel is? Raise your hand if you know. If you know, you know. Okay, I see a couple of hands. Yes, yes. And so guess what? A lot of times the doctors will tell you go home and do Kegels, but they don't ever tell you how to do them, how often to do them. And so a lot of times we end up trying to do things on our own. And we may be doing them correctly, or we may not be doing them correctly. And so it's important to know where those muscles are located. It's important to know how to do them. That's why I'm an advocate for pelvic floor therapy, because I can tell you how to do those things the right way, okay? So tight pelvic floor muscles, weak pelvic floor muscles can cause this. Constipation can cause this. Underlying sexual traumas can cause this. Injuries, even toilet training at an early age, right? If they're too early to learn, sometimes kids will revert backwards, okay? And also, when they're toilet training and you give them negative feedback, sometimes it makes them go as well, right? And have incontinence. Pregnancy, postpartum, vaginal or rectal tears, episiotomies, muscle ligamentous laxity in the elderly, and poor activity. Even diabetes can also cause this. And the reason that diabetes causes this is because, and this is something that we in our community deal with a lot, but the sensations inside of the bladder, because the nerves are very sensitive, you no longer have that and those nerve endings working in your bladder as much as you did before, and guess what? Now you have problems with incontinence, okay? So if you know someone who is diabetic, or if you're diabetic yourself, make sure that you are checking your pelvic floor and you know how to do these exercises so that you're not having any of the leakage, okay? So here we are, urinary frequency and urgency. Anybody know what that is? I'm gonna tell you, but what is it? Who is it? Who says it more? Yes.
Frequency is when you go off and what was the other one?
Urgency.
Urgency, you feel like you gotta go, but you may not go.
You may not go when you get there. You may not. And she's exactly right. Like, frequency is going more than 6 to 8 times in a 24-hour period. If you're using the bathroom more than that, you have a little bit of education that needs to happen and bladder retraining that needs to happen. So that's 6 to 8 times in how long? 24 hours, okay? Then urgency is going to the bathroom with a very strong, overwhelming urge to urinate. And then you get in there, and sometimes just a little bit comes out, or maybe nothing at all. Yes, you had a question.
Wait, hold on.
It's not working? Can we get that mic on? Okay. Yes. So what happens with that? 8 glasses of water a day? Oh, you said 8. Yes. So when you're drinking water, the best way to drink water is not to gulp it down. The reason why we have urgency is because we drink, and it's a shock to our bladder, right? So your bladder is a muscle, and that muscle should expand. So as you're drinking the water, if you're taking it in a little bit at a time, it allows the bladder sensors not to just go off, woo, I need to go to the bathroom. So we should be drinking water, right? Everybody doesn't need 8 glasses of water. I know that's what we were taught when we were growing up, but you may need more. Some people may need more, some people may need less. It's really based upon your body weight. And your health, yeah, because there are a lot of people who are on dialysis who can't have that much fluid, right? And so they have to really manage that. But that's a good question. And again, if you all have questions, let me know. Like, I don't mind. That's why we're here to talk. Somebody had one more question, Ms. Moore? Oh, he's trying to get a microphone. Yes. I'm excited. I'm excited that y'all have questions.
Testing.
I love this.
Okay. Sister Moore? Okay.
Thank you. Whew. Okay, I just wanted to make a comment because we talked about the 8 glasses of water, but if you want to know how much water you need, you take your weight,
Body weight.
divide it by 1, and then divide that by 8, and that will let you know how many 8 ounces of water you should have a day.
Okay. Thank you. Thank you, Sister Moore, for saying that. All right. So overactive bladder. This is something that's a little bit different. This is when the signals from your brain are sent to the bladder, and it causes the bladder muscle to contract, making you feel like you have the urge to urinate. Again, it's when you're going to the bathroom multiple times, more than 8 times a day. Sometimes with overactive bladder, people have something called UUI, which is urinary urge incontinence, right? So that means I can't hold it, right? I am coming into the house. I just pulled up into the driveway, and all of a sudden, boom, that urge hits you, and you're like, oh, right? What do? Panic. Or sometimes people will rush to the bathroom, and you will lose it on the way because you didn't stop to breathe. We're going to go over that in just a second, right? So stop and breathe. Woo, who said that? Yes, stop and breathe. We're going to talk about some techniques to manage this, okay? Moments when urge incontinence strikes. So sometimes and urinary urge incontinence or urinary urgency will strike at these times. When you're standing up from a chair, trying to get out of the car, early mornings, when you wake up in the morning, it's like, whoo, as soon as my feet hit the floor, I gotta go. Running water, that ever happened to you? Rainy days, driving into your driveway, we just talked about that. Going out into the cold, sometimes we're activated. And then just passing by a restroom. Yeah. Sometimes it will happen. So there are some people who even know like what exit they can get off on. They map their journey by bathrooms and if they're clean or not. Yes. So just be careful with that. So what are some of the things that we try to get people to do? Go to the bathroom. This is a part of bladder retraining. You should be going to the bathroom every 3 to 4 hours. Sometimes we will say every 2 hours, depending on the person and what they have going on, but no less than 2 hours. So if you're going to the bathroom and then in 30 minutes you're like, ooh, I need to go again. And then in 45 minutes, ooh, I need to go again. Something is probably off and you need to talk to your doctor about it and maybe refer yourself to a pelvic floor physical therapist. We tell people, don't do a just in case. What's a just in case? Anybody know? Come on.
Go to the bathroom
Just in case. I'm going to use this bathroom before I go to the mall. I'm going to use this bathroom before I leave the house. That's how I grew up, right? My mom was like, no, you going to go to the bathroom right now. You're making me go to the bathroom? But my brain is not telling my bladder that I need to go. Yes, Mr. Jones? You do it to... Yeah, just try.
But we do that to kids. So what's the
Right.
difference when you're saying to a kid, oh, we're getting ready to go use the bathroom before we leave?
We should not do that to kids. And that's what I'm saying. That's how we grew up. It was, you go use the bathroom before you leave the house, regardless. Yes, Mr. Jones?
What about medically induced, the medications that you receive?
Yes. That's also something you have to take into account, which is why I said we try to put yourself on a bladder training schedule every 2 to 4 hours. Usually for those who are, if it's medically induced, then yeah, you may have to go a little bit more often, so that's the 2 hour. But it should never really be less than 2 hours, that we should be able to hold it. Now, if we are not able to hold it, then you gotta figure out, okay, is my pelvic floor too tight? Is it too weak? Do I need to get stronger so that I can hold it a little bit longer, okay? So we also tell people to avoid wearing pads. That's like something that women do all the time because it's like, I'm going to leak, so I'm going to wear these pads. Well, sometimes wearing pads will give you a pass. It's like, oh, well, if I leak, then, oh, well, nobody will ever know. And so we hide it, right? We do. But the point is we need to make sure that we're learning to control the muscles, not just being in a place where we pacify the muscle and just say, let me put this pad on. Yes, I have a question.
Okay, and especially for women, if you're wearing pads, remember that urine that's trickling down on that pad and staying for hours is going to cause a urinary tract infection.
Absolutely.
So you want to be careful about keeping that same pad on for hours.
Yes.
And then you need to cleanse after you
Absolutely.
get rid of that pad.
So I'm going to tell you why, and this is going to be probably a little bit much as far as details, but I would attend North Carolina State Federations every year when I was younger, every single year, and camp meetings, and it never failed. Anytime you go in a women's restroom, and I'm going to tell our business, it would smell. It would smell like fish. It would smell just odorous, just like, what is that? And when I was in physical therapy school, I learned that smell is coming from us using sanitary pads as people were having incontinence, and they were using sanitary pads because of that. Guess what? That odor comes from those pads. And when we're not changing those pads, they're giving off odors, and sometimes you don't even know that the odor is there until somebody tells you. But I'm saying this to my women, and I'm saying this also to men, because you're men of daughters, and you have sisters, and you have mothers. If you know someone who's having this issue, let's not pacify it. Let's seek help. Let's educate. Let's get out there and tell the world, because these people, we have pelvic floors, and we need to be educated on what it is that we need to do with our pelvic floor. Okay, I'm off my soapbox. All right, next, when you go to the bathroom, you see up here 8 Mississippis. What does that mean? Well, guess what? When I have a full bladder, I should be able to urinate for 8 seconds, and I count it. 1 Mississippi, 2 Mississippi, 3 Mississippi. If you're only going for 2 and 3 Mississippis, your bladder is not full. And guess what? You need to either do some bladder retraining, strengthen the bladder so you can hold it a little bit longer, but you should be able to urinate for 8 Mississippis or more. Some people go for 20 Mississippis, 15 Mississippis, right? Because their bladder is able to hold more. But if you're only doing 2 and 3 and 4 Mississippis, it's time for us to check. Are you dehydrated? Like, what's going on? Are you drinking enough? Do you have enough strength to be able to hold the pelvic floor muscles in?
Is there a count that is too long?
Yes.
Is there a Mississippi count that is too long?
Like if it's
Does
40 and 50,
Right, does it indicate
yes.
that maybe you're holding it
Right,
too
you're
long?
retaining it. You're retaining urine, yeah. And if you're holding it that long, you're probably not using the bathroom every 2 to 4 hours. You're probably like using it once a day. It's what we call teacher bladder or nurse's bladder, because we don't.
And these are my nurses right here.
Oh, these are
All of
nurses.
them.
Okay. Yes. Because we are trained to help others but not help ourselves. And that's what we do. We're trained to be on the floor or in the classroom or wherever you are for all of this amount of time, and we don't have anybody to come relieve us from breaks. So your bladder just it's a muscle, so it keeps growing and growing. But it catches up with you when you get older. That's the thing, right? So we have to look out for that. No straining when you're going to the bathroom. We should never strain. We should breathe. We should relax our pelvic floor muscles when we're sitting on the toilet, okay? Even if you're constipated, right? And that's another sign that you probably have some issues going on with your pelvic floor, is if we strain every single time you go to the bathroom, whether to urinate or to poop. Make sure you're sitting on the toilet. We're not hovering over the toilets. And I know we were all trained to do this. As women, we don't sit, we hover. And guess what happens when you hover? You can't relax. So then what happens? You can't empty. And you're retaining fluid inside of the bladder. And then what happens when you retain fluid inside the bladder? You get a urinary tract infection. It's a cycle. It keeps going on and on, right? So no nighttime just in cases. This is the next one. What does that mean? That means I'm waking up in the middle of the night because I got something on my mind, and I just say, let me just go to the bathroom just in case. We are not supposed to do that, right? If you need to use the restroom, it is okay to use it at least once, maybe twice a night. That's pushing it. Once a night, it's okay. But you should be using it between 0 and 1 time a night. When you start getting 2 times and 3 times and 4, no ma'am. No ma'am. Question? I see. You got a question?
Yes.
Okay.
Okay, so I'm just gonna, it is what it is. So if I drink after 9, this week I was going every 2 hours. I looked at the clock. Every 2 hours I was going.
During the night.
During the night. And
Yeah.
and all my Mississippis, all 8 of them and more. Water.
Drinking water. So I will say this. When you're doing bladder retraining, you should stop drinking 2 hours before bedtime. So if you drink right before you go to bed, for sure you're going to have to get up and use the bathroom. So that's one of the first things we try not to do. Drink your water during the day, all day. That way you can go. Yes.
But if you were taking medication, you still gonna have to drink at night, because that's my problem. And then sometimes I go like 3 or 4 times. Most of the time, I'm going 3.
Okay. So what I would say is, if we're doing bladder retraining, if you were one of my patients, I would say, can we take our medicine a little bit earlier? Even if it's an hour earlier than when you're taking it. But if you're taking medicine after 8 o'clock, yeah, you're gonna have to get up. But the question is, what is it doing to your pelvic floor over time? Right now it might be okay, but then when you reach 80, it might be some issues, right? You may have a little bit more frequency, a little bit more urgency, not just at nighttime, but then it starts to carry over to the daytime, right? So we have to realize that you're preparing your body even now, right? So we want to get into good habits. Yes, somebody had a question in the back. Who was it?
Wait a minute.
Okay. I love these questions.
Is urinary incontinence, is it hereditary or is it part of aging?
So it's a little bit of both. It's a little bit of both. But just because your parent or grandparent had it, you have a tendency to have it, but you don't have to. I think a lot of the times we don't correct bad habits. We just take it for granted. Oh, it happened to mom or it happened to grandma, whatever, and my auntie or whoever. But I don't do the things to prevent it from happening to me. So yes, we inherit a lot of things, our DNA, but we can control some of those things too. It's kind of like diabetes. Well, just because, my grandmother or my mother or whomever had it, doesn't mean I have to. I may be more, susceptible or prone, thank y'all, to getting it, but doesn't mean I have to have it, right? We'll try to do things to prevent myself from having it, okay? The other thing I wanted to tell you about is we need to work on strengthening our abdominal muscles. If your abdominal muscles are weak, guess what? Your pelvic floor muscles are gonna be weak because it's all connected. So there are 4 different areas that make up your core. Does anybody know what those 4 areas are? We just named one. Starts with an A, I said. Abdominals. And then I said the second one's connected to your pelvic floor. The third is going to be your lower back muscles. And the fourth is your diaphragm. Who knew, right? So for people who have a hard time breathing, you have a hard time taking in breath, you have problems with anxiety, you have problems with depression or pain, we tend to hold a lot in and we don't breathe very well at all, especially if you have a lot of pain. So we take more shallow breaths when we have pain, right? And so all of that is connected. When you take a breath in, everybody take a breath in. Come on, let's breathe in. And then exhale out. So guess what? And I'm glad he said that because that's what should happen. When you're sitting on the toilet and you're straining, you're not breathing. You're holding your breath. But when you begin to breathe, it's supposed to help your pelvic floor muscles relax, not contract. And when you strain, you're actually contracting muscles, and that's not normal. So what should happen when you sit on the toilet and you really are having a tough time going, or if you're just going normally, breathe when you're on the toilet, okay? We go over a lot of this for people who have issues with constipation because that's the main time people hold their breath, and I'm like, don't do it. Breathe, take in deep breaths, and to be able to get, everything out. All right, so we're gonna avoid constipation. And again, you should be going between 6 to 8 times within a 24-hour period. We have 7 times on the screen, but that's the data, 6 to 8 times. And functional constipation, what is this? So this is a condition in which a person has uncomfortable or infrequent bowel movements. They have decreased emptying that's usually associated with hard stools. Now, what's funny to a lot of people, and it's funny to me, let me say that, is that I have people come in and say, I'm not constipated. That's the first. So when you come into my office and you have, or I come to your home because I'm a mobile therapist, I will ask this question: are you constipated? Even if you come in for urinary incontinence or urinary urgency or frequency, I'm always dealing with the bowel. And why is that? It's because of the anatomy, right? You don't know, but on that pelvic model that my cousin had around, there's a bladder, there's a bowel, rectum that's attached to it, and it's not actually in it right now, but the bladder, the uterus, and the rectum all sit one behind the other. So here's the bladder in the front. Here's the, no, not just rest. But the bladder's in the front. Wait, go back to the mic. Okay. So the bladder is in the front, rectum is in the back, uterus is sitting on top, right? And then the vagina is all the way through if you have a vaginal wall. But anyway, what I'm saying is if the rectum is full and impacted, guess what happens? It compresses the bladder. And so then what's gonna happen is you're gonna have more frequency of urination, feeling like, I got an urge to go to the bathroom, right? So if your rectum is not cleaned out, it's going to affect your continence. So that's the first thing that you need to check. If you're not having full and complete bowel movements, and I mean full and complete, right? I'm gonna go to this next slide because I think this is the one I wanted to show you all. So I'm not sure if you can see this. You can pull it up on your phone or you can pull it up on your computer, but it's called a Bristol stool chart. Can y'all say that with me? Bristol stool chart. How is your poop, right? When I ask that question to most people, they're like, what? I don't look at that. Why not? It's yours. So we have 7 different types that these will fall in the category of, and normal is 3s and 4s. Most of the time, when you're constipated, you're on the side of 1s and 2s. So you need to know, even if I'm having a bowel movement every day, but it doesn't look normal, I'm constipated. Yeah. So what can we do about it? We need to drink water. We need to eat fiber and vegetables. Get on that protocol. Where's my auntie? That protocol will keep you. I don't know if y'all know about it. I'm going to have her tell you about it. But the vegetables and the fruit, it increases your fiber. Some people have to do Benefiber or Metamucil or whatever. But if you get on that protocol and you're doing it all natural, you can really get your bowel movements very regular, right? Some people have to use other things to help them. But this is the question. How is your poop? Once you get that situated, then we can start working on retraining your bladder, okay? But first things first. So, healthy habits for bladder control. Make sure that you are emptying your bladder before starting a trip. Here we go. That is going to be greater than an hour. Now, if you know you're traveling and you're going to be in the car for maybe 30 minutes, the whole I'm going to make myself go, let's try not to do that if we can, okay? Don't make yourself go to the bathroom. And the reason you don't want to do that is because the signal from your brain that tells your bladder, hey, I'm responding because I need to go, it begins to go away if you ignore it all the time and you just going because you want to go, right? It should not be that way. Our bodies are made to be able to respond to the signals that are coming through our neurological pathways in our brain. That's the way that God made us. So train your bladder to be able to lengthen times between voids. If you know right now you're going every hour and a half, try to see if you can stretch it out. Let me push it off for 15 minutes today, when I need to go. Can I, because we know normal is what? To go to the bathroom every 3 to 4 is, but I'll give you some leeway with 2, right? But your goal is to get to 3. Right? So if you start at an hour and a half, maybe push it off 15 minutes, go to an hour and 45, and then maybe in another week or so, I could push it off to 2 hours, and then you keep on going, add 15 minutes at a time. Does that make sense? Okay. We are avoiding just in cases. We talked about that. And remember to remain at the toilet to ensure emptying of the bladder. What do I mean by that? Make sure it's all gone. What happens a lot of times with us, we are so busy. It's like, I want to go in here, I'm just going to pee a little bit, and then I get up and I go, and you didn't even finish. Let's finish. Don't rush, right? Decreasing obesity helps also with urinary incontinence and decreasing smoking. And then, like we said before, having regular bowel habits. So, some simple steps to do. If you have urgency or you know someone who has urgency, stop what you're doing, sit down if possible, and relax your body. Try not to get in such a rush where, I gotta go, and then you just take off running or walking really fast to get to the bathroom. Try not to do that. I want you to just stop, breathe in for about 3 breaths, right? I got a strong urge to go. I see that garage door opening, and that urge is hitting me. What are you gonna do? Stop. Stop and do what? Breathe. How many breaths? 3. Take 3 breaths. Then you're going to squeeze your pelvic floor muscle. Okay, now is our time to practice. How many of you know how to do a pelvic floor exercise? I see 1, I see 2, I see 3. Okay, let's think about where our pelvic floor muscles are. We're sitting on them, right? Can everybody sit up tall? Take a deep breath. You should actually feel the pelvic floor muscles descend. And you relax. Exhale. So when you inhale, the muscles descend. That means that they go down. Right? If they're going up, that's a problem, right? We need to try to retrain that. So you breathe in, feel the pelvic floor going out, and then you're going to exhale. When you exhale, your pelvic floor muscle automatically contracts a little. You're going to help it by pulling in. So think about, where do I poop from? Where do I urinate from? Okay? So think about that. We have, for females, for born females, with female genitalia, how many openings do you think you have? 3. Somebody said 7. Somebody said 2. Somebody said 3. 3 is right. Where do you have your openings for female? Those who urinary, fecal for rectum and vaginal. Come on, y'all smart. Okay, so we're gonna pull all 3 of those in for the females. Okay, so we're pulling in, right? Now, see, no. I just saw somebody say. When we breathe in, they are going to go down. And then as you exhale, that's when you're going to use the breath to help you squeeze in those 3 muscles. Okay? So,
They can't hear online.
y'all can't hear online, I'm sorry. So we have the rectum, we have the vaginal opening, this is just for females, and then you have your urethra, right? Which you do what? What happens at the urethra? You pee, you void, right. So we're gonna pull in all 3 at the same time, from back to front, okay? You should feel it lift away from the seat that you're sitting on, right? So we're gonna inhale, things should fall. We're gonna exhale, we're gonna bring that muscle up together. Does that make sense? Yes, okay, so here we go. Everybody taking a big breath. Everybody. It's okay for y'all to breathe too, even though y'all not doing the exercise. Females are exhaling. As you exhale, you're gonna pull in 1, 2, 3. And then let it go. Did anybody feel it move? Yes, no, maybe so. Yes, I got 1 yes. Okay, we're gonna try it again. Did you feel yourself relax first? You did feel the relaxation happens when you do what? Breathe in. When you breathe in. So let's do it. We're breathing in. We're letting go of the pelvic floor. Exhale. As you exhale, you're going to squeeze in that 1, 2, 3. And I will tell you a secret. If you see anybody who's doing a pelvic floor exercise and they're doing this, it's wrong. You should never be able to see anybody do the pelvic floor exercise. That way, you can do it when you're sitting in church. You can do it whether you're in the car. You can do it in the mall. Wherever you are, nobody should know what you're doing, okay? If you're doing it correctly. right? So we're gonna try it again. This is for my men now. So, men, how many openings do you have? Okay, come on. We got smart men in the house. Right. So, and this is the question. Do men have pelvic floor? Yes. Can men have leakage and urgency? Yes. Oh, y'all smart. All right, so men, we're going to do it as well. We're going to breathe in. As we breathe in, we're relaxing our pelvic floor. As you exhale, you're going to pull in from the anus, lifting up towards the penis and bladder. Here we go. Breathe in, everybody. Exhale and lift. 1, 2, 3, and let it go. You should have felt a lift away from the pew that you're sitting on, and you should have also felt the muscle going back into the pew that you're sitting on, okay? Did everybody feel it? Yeah. If you didn't, you need to come see me. We have a question.
You may have answered this earlier, but what is the difference we should feel between the Kegel exercises and what we just did with our pelvic floor?
So that was a Kegel exercise. There we go. That was a Kegel exercise. It's also called a pelvic floor contraction. But before we did the pelvic floor contraction or Kegel, what did we do first? We breathe, and what happened to our pelvic floor? It descends and relaxes. And what happens with a lot of people is we don't know how to relax those muscles. And so then when we don't relax them, we cannot empty. When we don't relax them, we also have pain. That can happen as well. So teaching women and men how to relax their pelvic floor is very important before moving into contracting, okay? So with urgency, yes, somebody has a question.
Okay, babies breathe correctly. But as you get older, instead of breathing and expanding your lungs, they do your belly. Okay, so we are breathing incorrectly to begin with.
We are.
So we need to have exercises on how to breathe.
I'm so glad you said that. Let's talk about it, okay? This is real-time physical therapy. Everybody take your hands like this, and you're gonna put them around your rib cage here. So I want you to give yourself a little nudge in. So you're gonna push in, and you kind of feel the rib cage, right? I'm gonna have you come up a little bit higher. So women, you should be right up under where your breastbone is, right? Right around. As you take a breath in, you're going to feel your rib cage expand into your hands. So go ahead and breathe in. And you feel the rib cage expand. And then as you exhale, you should feel the rib cage come together, right? So it retracts, right? So what happens with a lot of people when we take breaths in, we take a breath in like this. Everything is up, and you're not taking a full breath in. You should be able to keep your shoulders down as you breathe and expand. Only thing that should be moving here is your pelvic floor and your rib cage, right? Take a breath in. Let's try it again. Ready, set, go. Inhale in, grow, 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 grow. Exhale out. Did everybody feel it? Okay, so. So guess what? You suffer with constipation, anxiety, depression, any of those things, activating your breath, which is something naturally that God gave us, right? He's the breath of life. Amazing. He gave us, he said he breathed into us the breath of life, and man became a what? Did. So that's how we live. If we learn how to breathe, we can resolve so many issues with stress and anxiety. And I have learned this. I have taught classes on this. The reason that a lot of us suffer from stress is we don't breathe correctly. And when we breathe, Let me tell you, you activate something called your vagus nerve. You can go and look it up, VAGUS. It is a calming system that God has given us. It's automatic. Connected to your autonomic nervous system is your breath. So just taking in, if somebody's stressing you out right now, just go ahead and just take a big breath in. I'm telling you, it makes a difference. Big breath. And so even in my classes, I teach you different breathing patterns to be able to respond to, because everybody doesn't like, all of the box breathing and the 1, 2, 3 breathing and all that. But there are different types of breath work that you can do to try and help relax you. So with urgency, this is where we are today. You're going to take 3 big breaths. You're going to follow that with 3 quick contractions of your pelvic floor. And then I'm going to give you a secret. You're going to contract your toes 10 times. What does that mean? Contract my toes. If I take off my shoe and I make my my toes go up and down. Can y'all see that? I don't even know. No. If I contract my toes like this. Contract your toes like this 10 times. 10 times. You don't have to hold your foot up in the air. I was just doing this so you all could see. But you're going to decrease the urge to urinate. So people wonder, well, why is that even helpful? It's because of where our nerves are innervated from. So S1 and S2 nerve root, which goes to the bladder, also goes to your toes, right? So your big toe is innervated, and when you contract the toes back and forth, you're basically just calming that whole system down. So you do your 3 breaths, then you're going to do 3 quick contractions of the pelvic floor, then you're going to do 10 contractions of your toes back and forth, and you keep repeating that cycle until you're able to get up and calmly walk to the bathroom. This is for people who have urgency frequency, okay? So it really, really helps. That was just a tip, quick tip. Any questions about that? Yes.
Can I get a clarification on the quick tip? For the, I'm logical. Okay, so you said 3 breaths, 3 contractions, 10 toes. With the breaths, are you calling that the inhale, which we relax, and then exhale? Is that the first one?
No.
So is it 3 in between that?
It's 3 breaths. You literally breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out, contract. Quick, 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 and then toes. 1,
Thank you
2,
so much.
3, 4, 5, 6, 7, 8, 9, 10. Then you do that routine all over again. Does that make sense?
Amen.
Okay.
Thank you for waiting. Quick question. So is that in the moment, or is that building towards having a stronger or healthier
That's
pelvic
in the
floor?
moment.
Oh.
In the moment. And it gives you something to do, really, to take your mind off of it. So this is when you're sitting in the car and it hits you. This is when you're walking past the bathroom, or you get in the bathroom and it's like, oh, you know how we go through the whole potty dance and everything, right? And so instead of doing all that, just stop, breathe, and do your quick contractions. And that gives you time, it buys you time so that you don't leak, okay? So we're gonna move on with urinary urge incontinence. We talked about that, right? That's the involuntary loss of urine with a strong feeling of need to urinate. Stress urinary incontinence comes when you leak with coughing, sneezing, dancing, lifting, exercising, any of those things, right? And then you have mixed urinary incontinence, which is a combination of both. So I just wanted to make sure that we clarified what that is, right? You hear people say stress incontinence. Well, why do they say stress incontinence? Or why do they say urge incontinence? It's 2 different things. And so when you control incontinence, again, you need a bowel regimen to help decrease constipation. Do not rush. That's the worst thing that you can do. We do our pelvic floor muscle relaxation, breathing, let it go. Then we do our Kegels, which is the pelvic floor exercises. We just talked about that. And then we want to work on strengthening our core muscles. So that's that abdominal wall. And so with pelvic floor contractions, we talked about doing the quick 1 second holds. But then you can also do a slow 5 second hold. Let's try it. Can you breathe in, breathe out, hold the pelvic floor for 5, 4, 3, 2, 1, and then let it go. All right, we're gonna try a 10 second hold. Inhale in, exhale, and squeeze in. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. How many of you were able to do it for the whole 10 seconds? Oh, we got some 10s? Okay. Now we have a different pelvic floor exercise. This one is the elevator. This means I'm going from the first floor to the second floor to the third floor to the fourth floor. So you're not just going all the way, right? You're not just going to do a pelvic floor contraction as strong as you can. You're going to do it in increments, right? So you're going to go a little bit, pull in a little bit more, pull in a little bit more, pull in a little bit more, a little bit more, a little bit more. Are you at the top of your elevator? All right. Now we're going to slow it down, coming down the elevator. Come down a little bit. Come down a little bit. Now, how many of you able to come down a little bit, or did it just fall all the way to, see? So if it fell, we need to work on control, right? Okay? Yes.
Am I supposed to be when we did, whew, that was a lot. After the 5 seconds to the 10, am I breathing normally, or am I still trying to do this inhale and then exhale? I got lost.
Breathe normally.
Okay.
So I was literally just taking y'all through what some of the things that we do in our routine, but it's not like this. You would do like 10 quick contractions, like pull in, let go. Pull in, let go. Pull in, let go. You do that 10 times. Then I would give an exercise where if a person needed more endurance, like say they're not coughing and sneezing and peeing, but maybe they have a hard time holding their urine if they're just walking around doing daily activities. So then I want to work more on the longer holds versus the short, quick ones. But definitely take a break and breathe in between. I'm more concerned about the quality of movement than the quantity. If you can't get through 2 and do them well, then please don't try to do 20. Or some people will say, oh, I did 100 Kegels. I'm like, you probably didn't. You know, you probably did maybe 10 that were wonderful Kegels, right? Where you were able to pull in and hold it for the entire time. But the whole just, oh, I can just do it and do it all day long. No, you're going to wear your pelvic floor out because the pelvic floor muscles are really thin. Very, very thin, right? They're like as thin as a piece of toilet tissue. Then when you become like after menopause and we get a little older, it's like a piece of toilet tissue with holes in it. Think about that. Yeah. And then, so we need to work on strengthening. Okay, some of the core abdominal exercises that you can work on are bridges. You know what a bridge is? Okay. That's like laying on your back, lifting your hips up off of the table or off of the floor. We need a demonstration. If I had on pants, I could, but I can't right now. Look it up on your phone. Look it up. Bridges, clamshells. You know what that is? The hip opening exercises, laying on your side. Avoid sit-ups and crunches. Woo! 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 Why do you think they tell people who have pelvic floor dysfunction to avoid sit-ups or crunches? The stress on the pelvic floor, all that pressure is going down, and it leads to something called pelvic organ prolapse. Mm-hmm. So you have to be really, really comfortable with that, but yes.
So if you can't do sit-ups, then what do you do?
So you're going to do abdominal exercises, which are called TA contractions, transverse abdominis exercises. What does that mean? So think about where your pelvic bone is. Okay. Abdominal wall. is a part of your abdominal wall. So you have your transverse abdominis is the deepest muscle. Transverse abdominis. It's the deepest muscle of your abdominal wall, and you want to try to activate that. When you activate that by pulling your belly button in and up. So if I am standing here and I grow tall through my bun here at the top of my head, what's happening to my abdominal wall? And what? Yeah, so for you, sit really tall, and as you sit, think about my posture, and I want to grow my posture all the way up. Do you feel activation of your abdominal wall? So that transverse abdominis is what you want to be able to feel when you're doing exercises. So whether you're in the gym and you're doing rows, or if you're doing push-ups, or if you're doing whatever, you need to make sure you're activating that muscle, right? But the reason why we tell women to avoid, specifically women, to avoid doing sit-ups is because of the pressure that it puts on the pelvic floor muscles. Yeah. So am I telling you never to do a sit-up or never? I'm not saying never, but I'm saying you may need some training to help you do it appropriately, because what will happen is you'll end up having other issues that it could develop into. And I have seen some women who come into my office and their bladder is literally sitting on the table. Literally. So we're trying to avoid that. Okay? Any other questions about that? Thank you, friend. Could you feel your transverse abdominis? When you grow tall, could you feel that? And I'm asking that to a lot of my seasoned saints, because a lot of times this is what we see as we get older, and I talk to my parents about it all the time. We see this. And what is that? You call it a humpback. I call it rounded shoulders. Yeah, because it's easier to sit like this, right? But we don't breathe well here. You breathe better when your chest is open. So think about growing tall is gonna also open up your chest as well and help you to be able to breathe better. So sometimes just working on breathing helps tremendously with my patients, especially those who can't do Kegels. Man, I'll just get them in there and just start working on breathing. Let's just do breathing. We're gonna stay away from Kegels because that just confuses people sometimes. But when you start to work on the breath pattern, they respond. Their pelvic floor responds automatically. Yeah, so. Any other questions? I'm sorry. Yes.
Do you have the Kegel machine?
I don't have one. When you say a machine, you mean like electrical
That thing on
stimulator?
the commercials.
So there are some, Kegel, there is pelvic floor trainers. I usually will use something called electrical stimulation, which you can use those with vaginal sensors, rectal sensors, and things like that. So I'm thinking that's what you mean by machine.
We saw the commercial over there in Raleigh that they have the Kegel machine.
Okay.
That you can come over and sit.
Oh, sit on it. Yes, I've seen those.
To do the Kegels.
I don't do those. I mean, personally, I've never treated patients with that because, well, I have my own reservations, but I do think it's better. It's always better for you to be able to activate the Kegel yourself versus having a machine to do it for you. Mm-hmm. But I can't say it doesn't work. I'm not going to say that. Yes.
What is the best and simplest way for me to help a kid, help my child?
With bedwetting, constipation, or both?
Frequent urination, like she
Okay.
can go every 30 minutes.
Okay.
And I don't know about constipation.
Mm-hmm.
But just help her in general with holding her bladder longer.
Okay. So I would start with doing a bowel regimen, making sure that they're not constipated. And then after that, trying to teach them how to do Kegel exercise, because kids can do them too. Well, of course, my recommendation is going to be pelvic floor physical therapy, right? But if you want to do something at home, for sure, I would start with the bowel regimen and make sure that they're not, make sure that they have a good bowel program. So they're going to the bathroom every day with type 3 to 4 stools and making sure they're drinking water, not having a lot of sodas and juices and things like that because the sugars are going to make them go to the bathroom more. So I would start with that and then doing the Kegel exercises. Yep. Okay. Some of the other abdominal exercises you see here on the screen: planks, external rotation of the hip. So that's like putting a band around your knees or actually using the machines in the gym that push out. Those are good. Marching, leg lifts, right? But again, when you're doing these exercises, you're growing tall. As you're growing tall, you're activating your core muscles at the same time, okay? So you want to go see your doctor if your urgency is interrupting your life. If you're having urinary leakage, right? That's never normal. Some people say, oh, I leaked because my mom leaked or whatever. Or I just had a baby. Oh, this is the one I hear a lot too. I just had a baby, so that's normal. No, it's still not normal, right? If you just had a baby and you're having leakage, go see a pelvic floor therapist. But tell your doctor first and then have them refer you to a pelvic floor therapist. If you're having pelvic pain, people think that only women have pelvic pain. Men have pelvic pain as well. But theirs is usually more posteriorly sometimes. I can't say always, but sometimes they will feel like there's a strong spasm in the rectum. And so I used to treat physicians who would sit a lot, or it may be people who just sit all day, but physicians specifically, I don't know why, but they would sit a lot and hold a lot of stress. You can't really let people see you sweat. So you hold stress in other places. And so they would hold it in their anus. And then they would get that anismus and pelvic floor dyssynergia and spasms. Whew. Okay, lastly, if you are constipated, see your doctor and be referred to a pelvic floor therapist. Who had a question? I'm sorry.
For our men that have had prostate cancer,
Yes.
it is important, I learned from you with my husband, it's important that they do Kegels as well.
Yes.
To help with that.
Urinary incontinence,
Yes, urinary
urgency,
incontinence.
frequency, all of that. So if you have had prostate cancer or know people who have prostatitis, enlarged prostate, things like that, benign prostatic hypertrophy, those things, and it's called BPH. A lot of times the doctors will say that BPH, that's what that means. So you may have symptoms of urinary urgency and frequency, just like women, right? But of course, if women are not talking about it, guess what? Men are definitely not talking about it. But it happens. And know that if it does, there is help. You can be seen by a pelvic floor therapist to help you with that, okay? You can ask for a referral, women, to a gynecologist or a urogynecologist. A urogynecologist is a person who specializes in urology and gynecological services. So they're very specialized. I really want to advocate for urogynes because they deal with a lot of women who have had fibroids, pelvic pain, endometriosis. If you want to have a different opinion, other than your gynecologist who's telling you go have a hysterectomy, make sure you see a urogynecologist. Not saying you don't need a hysterectomy, because sometimes you do, but you can avoid it as well, okay? Ask for referrals for a physical therapist. You can ask your family doctor also, let them know, and they can prescribe you medication sometimes if you need it, but I always advocate for therapy first before having to go on meds, okay? And then also exercise group classes work to build the core and pelvic floor. So here is my information. If you need a physical therapist, I would have to do mobile services to your home, or we could do virtual visits if that's something that you need. But I have an independent practice. Feel free to take a picture of this slide, or you can email me. My website right now is under construction, so I'm in the process of redoing that, but you can email me or call me, okay? And I appreciate you all. If there are any other questions, oh, somebody want to take a picture? Any other questions at this time? We have one more.
I don't have a question, more so a comment. I just applaud you for this seminar because there is such a big stigma. You already said if women aren't talking about it, of course men aren't talking about it. But like you said in the beginning, we don't talk about it because it's so personal, it's so private, and nobody wants to be concerned about, oh, do I smell? Does somebody else smell me? Da, 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 da. So thank you for what you're doing.
Oh, you're welcome. To God be the glory. To God be the glory.
I want to put another plug in. Thank you, Keisha. Keisha, right? Yeah. For men. So my husband had, I know, but I'm doing this for men because it's common. So my husband had some kidney stones, which led to some surgeries, whatever. And so he was having some issues as well. I said, you got to call Katrina. Praise God, she's in the family. But I'm saying this to say, men don't talk. And if he weren't my husband, I wouldn't have known about it, and he would have suffered needlessly. He talked to Katrina one time. I think y'all were on the phone for how long? Maybe about 30 minutes? Yeah, 30 minutes or so. He was like, oh my goodness, she's amazing. That one conversation, which led to him to go and get whatever therapist that she said, and he's fine. I'm saying that to say, hope he don't be mad at me. I won't let him see this. But I'm saying it because I want men to feel empowered to do something. Yeah, women, we always gonna advocate for ourselves, or our girlfriends gonna tell us, or our cousins will tell us. But men need to know you do not have to suffer as well. There are things out there, especially this pelvic floor thing, it impacts and affects all of us. So please share this information.
Yes. One more.
I came in late, and I can watch the video if it takes too much time, but these exercises, you talk about the Kegels and things like that, can you show it now, or do you not have time?
So I can't really show you,
Or
but
describe.
I can tell you.
Yeah.
Yes. Let's walk through it together. Who thinks that they remember what to do? Let me put y'all on the spot. Anybody? Okay. Oh, okay. I thought you were volunteering. Yes. So when we take a breath in, what happens to our pelvic floor? The muscles should relax, right? So they fall into the chair that you're sitting on. Yep. As you breathe out, it's going to contract. So for men, I have you pulling in at the rectum and at the penis, and you're literally lifting up. You're gonna hold it, and I didn't tell them for how many seconds, because one, you're not my patient, so I don't really know exactly what you need. But just in general, if we wanna try to do a 1 second hold, you pull in, and then you let go. And you start with maybe doing 5 to 10 reps of that.
Okay.
Then I had them doing a 5 second hold, where you actually squeeze the muscle in, and again, you're pulling in from rectum, and you're going to lift up towards the penis and bladder, right? So you're doing that contraction. It should move away from the chair that you're sitting on, right? And then it goes back down. So you pull in and hold for 5 seconds.
Okay.
And then lift, and then release it. Then I had them do a 10-second hold, and then I had them do an elevator where they actually go from floor to floor. So you pull in a little bit, and then a little bit more, a little bit more, a little bit more, till you get all the way to the top of the elevator. Then you try to let it down slowly. So that helps more with control.
And you do sets of?
I usually, well, it depends on the condition. Again, for general, I would probably say start off doing 5 to 10,
Okay.
and then no more than like 30 in a day.
Okay.
I would do like 10 in the morning, 10 in the afternoon, 10 in the evening, of the same thing. Okay. So of the quick contractions, then of the slow contractions, you could do that as well.
Okay.
Yeah.
Thank you.
Don't overdo it though.
Okay.
Because I've seen some people who will overdo it. It's like every hour I'm doing 100 Kegels, but now I'm leaking again. And I'm like, well, that's probably because you have overactive pelvic floor muscles now because you've been doing too much. So now we need to relax. Yes.
And will this help with someone who has like trouble urinating, I guess prostate issues, trouble urinating, or is that like completely separate?
So that's going to be separate.
Okay.
So if you have problems with like an enlarged prostate, prostatitis, if you have had issues with retention and not being able to go, we're going to need to focus more on relaxation. So that's where the breathing comes in. And we went through some breathing exercises where I had them put their hands on their abdomen, more so at their rib cage, to feel as you take a breath in, being able to relax and allow the rib cage to open, and that allows the pelvic floor to relax so that you can get all of the urine out. Because what happens with people who have enlarged prostate is they go in the bathroom and they strain to try to get the pee to come out. Because it's like, I know I need to go, I got this strong urge to go, but nothing's coming out. So, and as you strain, it actually makes it worse.
Okay.
So sitting and breathing is gonna be the best thing.
And I guess any PT can kind of run through that, or is it specific?
Pelvic floor PT.
Okay, okay.
Any pelvic floor PT,
Okay.
yes.
Okay.
Yes.
Okay, thank you.
You're welcome. And again, if you need a mobile therapist, or if you need a consultation, like a virtual consultation, I can help you with that. Anybody else? Questions?
In your experience, is there any correlation between frequent urination and drinking tea?
Yes, absolutely. And not just tea, but anything that is a bladder irritant. So I didn't put that slide up here because sometimes it offends people. But teas, coffee, sodas, juices, chocolate. Now, I will say dark chocolate is better than milk chocolate, but yes. And so if it's herbal tea, but if it's caffeinated,
Does it make a difference if it's herbal tea? Will you experience less irritation?
You will have less irritation if it's herbal and no caffeine. Caffeine is a bladder stimulant, so it's going to stimulate the bladder, and not just the bladder, but your heart. It's a stimulant, period. So, yes. Mr. Jones.
Okay. Can I speak now? All right, thank you. What was the question again?
What was the question?
Yes.
Oh, the question was about teas bothering your bladder.
Yeah.
And so my answer was, did you hear what my answer was?
No. Yeah, I'm asking for someone else.
Oh, yes. So teas sometimes have caffeine in it, and caffeine is an irritant. And so it's going to speed up your bladder's urgency and the signal from the brain to the bladder that I need to empty, right? And so it's not just teas and caffeine, coffee, chocolate, juices. Sometimes even, like I had one patient to come, and they were like, I don't understand why I'm leaking so much, and I have strong urge. I said, well, what are you eating? They were like, well, I eat this, and I eat grapefruit. Well, how many grapefruit are you eating? Because grapefruit is acidic. So acidic things are also going to affect your bladder. She was eating 10 grapefruit every day. And I'm like, well, grapefruit is good, but you can't do that much. Soon as she stopped doing the grapefruit, the urgency went away. So again, it was too much. Sometimes too much of a good thing is wrong for you.
I have a question. You mentioned the women when we are, and I know when we're out in public, we should not hover. What is your suggestion? Because I'm a hoverer.
Yes.
I'm
So we were
in
all
public.
taught to be hoverers. And when I went to school and I learned that your muscles are unable to relax when you hover over the toilet, then you have to use the toilet paper covers, or you put toilet paper on, line the, or hand sanitizer. Oh, to clean it off? Oh, okay. disinfect it. You still not gonna sit on it? You still not gonna sit? You gonna wait till you get to the house? Okay, yeah. But that's the recommendation, right? But of course, people gonna do what they do. Yes. And I respect it.
So how does how does sexual activity or lack of affect the pelvic floor
Yes.
or the condition of the pelvic?
Yes. So it is very, and thank you for asking that question. It is very imperative that those who are able to participate in sexual activity do so. And the reason is because it brings blood flow to the pelvic floor and it allows the muscles to coordinate. It is everything that we need. God gave it to us, right? For a reason, to be able to be used for pleasure with the person who God has given you to use it with, right? But if you have a weak pelvic floor, you may have issues during intercourse. One being, I leak when I have intercourse. Some people have a lot of gas when they have intercourse. Some people poop when they have intercourse, and that makes you want to like stay away from it. So because those things happen, you know, sometimes we don't have those conversations with our partner, and then all of a sudden our partner feels like, well, she doesn't want to be with me, or he doesn't want to be with me, but it's because of these other things that's going on with the pelvic floor. And so my advice is, if you're having any of those things going on, please go see a pelvic floor therapist, because they can help with that. And I want to do a whole other
She coming back, y'all. She coming back.
presentation on sexual dysfunction and the pelvic floor in the church. Because I think that it's very important that we talk about these matters in the church, because growing up, we didn't talk about it. It was a very taboo subject. It was a stigma placed on the pelvic floor. We don't talk about that in the church. But God, he made us, right? And he made us with the pelvic floor. So we should be able to talk about these things in public. So thank you for asking that. Did I answer your question? Okay.
I was also going to add pain during sex as well. Could be
Yes.
also related to pelvic floor, whether
Absolutely.
it's weakness or tightening.
Yes. And most of the time it is tightening, but it like from an overactive pelvic floor. But it can also be where you've never been able to have penetration. So some women cannot use tampons.
Yep.
And if you know of girls who are 13, 14, 15 who are having pain with using tampons, you need to really start thinking at that age, they need to go see a pelvic floor therapist, because therapists can help them to learn to relax those muscles so that when they do get married and they're ready to have intercourse, their body is ready and open to be able to do that, okay?
I was going to ask about hemorrhoids.
Yes.
Is there like a correlation with, because my mother suffers a lot from constipation, which is also related to hemorrhoids, and there was a pelvic floor therapist who talked to her about breathing instead of straining and things like that. And I think about, you know, labor and delivery, and when they're telling you to push and they're telling you how to correct the right way on pushing and things like that. And so made me think about those things.
Yes. So it's definitely correlated. Every time you push and strain, you're pushing on the blood vessels, which are a part of the external sphincter, right? So the muscle, when I speak of external sphincter, I'm talking about the muscle that surrounds your rectum here in the back. So that's the opening here. These muscles, the tissue that surrounds these muscles, when you strain, what's going to happen is these vessels are going to blow up, right? They're going to get enlarging. And when they get enlarging, they're swollen. These are the hemorrhoids that she's talking about. So how does this affect pelvic floor? If you have a tight pelvic floor, if you're straining to poop or pee, you're putting way too much pressure on what? The external what? Sphincter. And so then you're going to end up having problems with hemorrhoids. And then that affects you being able to sit. And then that affects you being able to walk. And then that affects you being able to have sex or go to the bathroom or do any of those things. Yes.
Lastly, about sitting on the toilet for a long period of time. Reading books and listening to stuff. And,
Yes.
Yeah.
So
And affect the pelvic floor.
recommendation, if you're sitting longer than 5 minutes, 5 minutes, and I'm saying to be able to start a bowel movement, you need to get up, walk around, drink some water, do some things, and then go back to sitting on the toilet. But if you have hemorrhoids specifically, do not sit for long periods of time, because guess what's going to happen? The gravity is going to pull down on those hemorrhoids and make them worse. Yes. Oh. Oh, she had her hand up too.
Okay, so I appreciate you coming. I learned about physical therapy with pelvic area clients. So I thought they were just talking crazy, but it's a real thing. But would this help someone that has had sexual trauma to relax the muscles so they can appreciate whoever they are whenever that happens? Because I have a client, it takes me hours to finish her, but I should refer her, if possible, to you to help her to relax. And then do you find a correlation with low back pain and pelvic? Okay, because I know someone.
The answer is yes to all of that. Yes.
Okay.
So especially with sexual traumas, that's another conversation in general. When you talk about overactive and uptight pelvic floors and not being able to have intercourse and pain, all of that exists because a lot of people are holding that tension inside of their pelvic floor.
Yeah.
And they can't let it go. And even when they try, they still can't let it go. So yes, they will need a mental health therapist, and they will need pelvic floor physical therapy to help with the relaxation. It's not always about medication, but sometimes they do have to get on. We have vaginal Valium for people who are unable, and I'm talking about Valium, like you take Valium to knock you out. They do that for the pelvic floor because people are unable to have any type of penetration, or they have increased pain and spasms inside the pelvic floor. Yeah.
It's a real thing, and it was life-changing. Like, oh, you can get a degree in this, and you know, my client, she is a physical therapist, and she was like explaining what she does, and I was like, oh wow. So, like other people have said, we don't talk about this in the church, we don't talk about this in families, we don't talk about this at all. And breathing is a great example just to relax and be still and just let the body do what it's going to do.
And tell them to come see me. Question.
Reason I wanted to ask a question is you said about the time spent in the bathroom. Well, I have 3 books in my bathroom. Crossword puzzle, cryptograms, and other puzzles. Now, I find I need that time to relax. Would that time be better served doing exercises that I wouldn't have to relax my body and my mind in order for things to function naturally?
So what I would do, I would start off saying, it sounds like relaxation is something that you need and it's important to being able to go to the bathroom, right? But we can relax in other rooms of the house. You can relax in the bedroom, you can relax before sitting on the toilet, just hanging there is what I'm saying. Hanging, especially if you have hemorrhoids. I'm speaking specifically for people who have hemorrhoids. It is, right, but even sitting with, okay. And if that's what some people have to do, okay. But the recommendation is for you not to really sit there trying to make yourself go to the bathroom. If it's about relaxation, there are other places to relax, right? You can relax sitting somewhere else, maybe in a chair in your room or on the bed or laying down. But just sitting on the toilet for long periods of time, sometimes that causes hemorrhoid, and I'm saying that specifically because the gravity pulling down on the pelvic floor. Usually with kids who have problems with constipation or people who have bedwetting issues, we put them on a bowel regimented program where they go to the bathroom right after they eat, right? So between about 10 minutes after you eat, your bowel is like ready to move. So we'll have them go sit on the toilet for 5 minutes. If they don't go, get up, move, walk around, do something else, go relax in another room. And then when you feel that urge coming back, then you go back to the bathroom and sit. I'll also tell you, for people who are constipated, sitting on the toilet, relaxing your puborectalis muscle, which is a muscle inside of the pelvic floor. It's a deeper muscle, and I wish I had just a chair, just a regular chair. But I would show you, let me just sit here. Let me use my coat, for example. I'm sorry. Yes, that's exactly what I was about to say. The squatty potty. Where you sit on the toilet. I'm gonna put this around my legs just because, yes. So you want your knees to be higher than your hips. And I don't know if she can see me, but my knees are higher than my hips. And then I wanna bring my arms forward to my knees like this, because it allows the rectum and the puborectalis muscle to open and relax in that position. Then you can poop a little bit easier. Using your breath in this position, you would breathe in. As you exhale, when you do that, you actually put breath on the pelvic floor, and it allows those muscles to open up and expand. Does that make sense? Okay, so that's squatty potty, and you can look that up online and order it. You can get another stool, yes. Like even using a step stool or a wastebasket, turn it over on its side or whatever, and put your feet up on that. The goal is just to be able to get your knees higher than your hips. Can you see that? Where my knees higher than my hips. Think about that angle. Okay. Next time, we're gonna change it. Yes. All right. Well, thank you all.
What's the standard of the number of poops per day?
1 to 3. If you're going more than 3 times a day, then 1 to 3. Some people are pooping 3. Yeah, if you have a vegetarian diet, a lot of times people just go. Anybody? You have?
A woman has a tilted cervix. Would that help with pelvic floor exercises or no?
Help meaning strengthen? What do you mean? So when it comes to intercourse specifically, tilted pelvic floors, or tilted uterus or cervix, sometimes you need to use pillows underneath your bottom to be able to position your vaginal wall in a different place so that when there's intercourse happening, it's not hitting right up against the cervix. Yes. Anybody else? All right. Well, thank you all for having me. Hopefully I'll be back to talk about sexual dysfunction at some point in time. Yes.
So we want to thank Dr. Heath for coming all the way from Charlotte, North Carolina. Thank you so much for all the information and education that you've given us. I want to bring her back to talk more. This was about introducing you to what a pelvic floor is and all the other things that happen with it. We're going to dive deeper into other elements. If you have questions or suggestions or want something more from her, please let me come and get served. The line starts at 12, so please come. We pull up, and it goes fast. You don't have to get out your car because I don't think it's gonna be cold tomorrow. But so if you need to volunteer or don't want to volunteer, please let your neighbors know that we are here to serve the community. All right, so let's pray. Lord, we thank you for this beautiful Sabbath day. We thank you for the information that you've given us. We thank you for creating our bodies the way you have. We thank you for being with Dr. Katrina Heath as she is educating us. We ask, Lord, that you'll cover her and Sharonda as they travel back to Charlotte this evening. Lord, we thank you for your love and your kindness, your tender mercies. We thank you, Lord, for all the blessings that you have given to us and showered upon us. We ask, Lord, as we go throughout this week, that we will be a resource for someone else who needs to know about who you are and how much you love them. We thank you so much for all that you've done for us and will do for us. We thank you for closing doors when we needed those doors to be closed and opening those doors that we need to be open. We give you all praise, glory, and honor. In Jesus' name I do pray. Amen. Amen. Oh, before I forgot. Thank you to my mother and her team for the meal today. Thank you to my health ministry team for all the support. Thank you, AV team, for bearing with me, and Pastor, wherever you are, thank you so much. And all those who